Your pet's heart is an incredible muscle. Think of it as the powerful engine that runs their entire body. Every single day, without a single break, it pumps oxygen-rich blood to all their organs, from the tip of their nose to the end of their wagging tail. This constant supply of blood delivers vital nutrients and energy, allowing them to chase a ball, pounce on a toy, or simply curl up for a good nap on the sofa. It's a job that never stops, and it's absolutely essential for keeping them happy and healthy. This amazing organ works tirelessly behind the scenes, a silent hero in their chest. So what happens when this engine starts to struggle? This is what we call heart failure. It doesn't mean the heart has suddenly stopped working altogether. Instead, it means the heart has become weak or damaged and can no longer pump blood as efficiently as it should. Imagine a water pump that isn't strong enough to push water through all the garden hoses. Some parts of the garden won't get the water they need. In a similar way, when a pet has heart failure, their body isn't getting the full supply of blood and oxygen it requires to function at its best. When the heart can't keep up, the body has some clever but ultimately unhelpful tricks up its sleeve. It tries to compensate for the weak pump. One thing it does is retain fluid and salt, hoping to increase the amount of blood in the system. It also releases hormones that make the heart beat faster and harder. In the short term, these changes might seem to help, but over time, they actually put even more strain on the already struggling heart. This can cause the heart muscle to stretch and get bigger, which sounds good but actually makes it weaker and less efficient in the long run. This process is why heart failure is often called congestive heart failure. The body's attempt to fix the problem by holding onto fluid leads to congestion, or a buildup of fluid, in different parts of the body. This fluid can accumulate in the lungs, making it hard for your pet to breathe, or it can pool in their abdomen or limbs, causing noticeable swelling. It's a cycle where the body's own survival instincts, unfortunately, end up making the situation more complicated. This is where a vet's help becomes absolutely crucial to break the cycle and support the heart. There are two main ways the heart's pumping action can go wrong. The first is a problem with squeezing. The heart muscle itself might be too weak to pump blood out with enough force. We see this with a condition called dilated cardiomyopathy, where the heart's chambers become enlarged and floppy, like a stretched-out rubber band. The second issue is a problem with filling. The heart muscle can become too thick and stiff, so it can't relax properly to fill up with blood between beats. This means there's less blood available to be pumped out, even if the squeezing action is still strong. So, what causes these problems in the first place? Often, it's due to underlying heart disease that has been developing over time. For many dogs, especially smaller breeds, a common cause is a leaky heart valve. The little doors between the heart's chambers don't close properly, allowing blood to flow backward, which puts a huge strain on the heart. In cats, a common culprit is a disease that makes the heart muscle abnormally thick, as we just mentioned. Other causes can include genetics, infections, or even certain nutritional deficiencies, though these are less common nowadays. As a pet owner, you are the first line of defense. You know your furry mate better than anyone, so you'll be the first to spot when something is not quite right. One of the most common signs of heart failure is a change in their breathing. You might notice them breathing faster, even when they are resting or sleeping. They might also develop a soft, persistent cough, especially at night or after they've been lying down for a while. This cough is often mistaken for a simple kennel cough, but it can be a sign of fluid building up in their lungs. Other signs to watch for include media group, tired dog or cat lying on floor, sad-looking pet beside owner, pet not interested in playing a stock or distribute its equally, a general lack of energy, or getting tired very easily on walks. A dog that used to love chasing a ball might now prefer to lie down after just a few throws. You might also see a decreased appetite, weight loss, or a swollen belly that looks bloated. In some cases, a cat might suddenly seem weak in its back legs. If you notice any of these changes, it's a clear signal that it's time for a chat with your vet. Don't wait for it to get worse. Early detection is key. To understand heart failure better, it helps to know that the heart has two sides, a left side and a right side, each with a different job. The right side of the heart is responsible for receiving blood from the body and pumping it to the lungs to pick up oxygen. The left side then receives this fresh, oxygen-rich blood from the lungs and pumps it out to the rest of the body. Both sides need to work together in perfect harmony. When one side starts to fail, it produces very different symptoms from the other. When we talk about left-sided heart failure, the problem lies with the pump that sends blood to the body. Because the left side can't pump effectively, blood starts to back up into the lungs. Think of it like a traffic jam on a motorway. The cars can't move forward, so they get backed up for miles. This backup causes fluid to leak from the blood vessels into the lung tissue itself. This is what we call pulmonary edema, and it's the main reason we see breathing difficulties and coughing in pets with heart failure. Their lungs are literally getting wet. Right-sided heart failure, on the other hand, involves the pump that sends blood to the lungs. When this side falters, blood gets backed up in the main circulation of the body. Instead of backing up into the lungs, the traffic jam happens before the blood even gets to the heart. This pressure causes fluid to leak out of the vessels and accumulate in the abdomen, creating a condition called ascites. You might notice your pet has a distinctly pot-bellied look. The fluid can also pool in the legs, causing swelling. Although this is more common in people than in pets, it's important to remember that while we talk about them separately, heart disease can eventually affect both sides of the heart. What starts as a problem on one side can put extra strain on the other, causing it to fail over time. A vet can determine which side is primarily affected through a physical exam and other diagnostic tests. This helps them tailor the treatment plans specifically to your pet's needs, targeting the symptoms they are experiencing, whether it's fluid in the lungs or fluid in the belly. When you bring your pet to the vet with concerns, the first step is a thorough examination. Your vet will listen to their heart and lungs with a stethoscope and may recommend further tests like chest X-rays or an ultrasound of the heart, called an echocardiogram. These images allow us to see the size and shape of the heart and check for fluid in the lungs. One simple thing I often ask owners to do at home is to count their pet's sleeping respiratory rate, the number of breaths they take in a minute while asleep. A consistently high rate can be an early warning sign of fluid buildup. While we can't cure heart failure, we have excellent ways to manage it. The goal of treatment is to improve your pet's quality of life, reduce the symptoms, and slow down the progression of the disease. The mainstays of treatment are medications. We often use diuretics or water pills to help the body get rid of the excess fluid that has built up in the lungs or abdomen. This can provide rapid relief from breathing difficulties. We also use medicines that help the heart pump more effectively, or relax the blood vessels to make the heart's job easier. What you do at home is just as important as the medicines. Your vet might recommend a special prescription diet that is low in sodium. Too much salt can make the body hold onto fluid, which is exactly what we are trying to avoid. Gentle exercise is still important to maintain muscle mass, but you'll need to avoid strenuous activity that could put too much strain on the heart. Short, leisurely strolls are much better than long, exhausting runs. Most importantly, you'll need to be diligent about giving medications exactly as prescribed and monitoring for any changes. Discovering your beloved companion has heart failure can be daunting, I know. But it's not an immediate end. With modern treatments and dedicated care from you, many pets can live comfortably for a long time after their diagnosis. The key is teamwork between you and your vet. Regular checkups and open communication are vital. Your role in monitoring them at home and providing a loving, low-stress environment makes all the difference. Your furry friend is lucky to have you looking out for them.